Hi, I'm Dr. Christina Johns, and this is your video prescription. We're going to look at what it means to have a sprain or a strain and how to take care of the injury at home. A sprain is what happens when a ligament is torn. Ligaments connect two bones together in a joint, so when a ligament is torn, the joint can become unstable. A strain is similar, but involves a muscle. Strains happen when the muscle is injured from being overstretched, often called pulling a muscle. Sprains and strains can be frustrating because they hurt, limit your functioning, and can take a long time to heal. So let's talk about what you can do at home to take down swelling, decrease pain, and get back on track. I like to start with RICE therapy. This stands for rest, ice, compression, and elevation. Resting the injured area is really important the first few days after an injury. This means you should not use the affected body part more than you absolutely have to, so the ligaments or muscles can start to heal. Ice works to decrease swelling and pain and should be applied for 15 minutes every 2 hours for the first 24 hours. Over-the-counter ice packs are great, but other options include frozen peas, a frozen towel, or ice cubes in a waterproof bag. Compression with an ACE wrap or elastic bandage can be helpful, especially if the injury involves a joint, like the ankle, wrist, or knee. ACE wraps help to make the joint feel more secure, which can reduce pain with movement. The gentle pressure also helps to bring down swelling. Make the wrap snug, but not too tight. It shouldn't cause the uninvolved area to become cold, numb, swollen, discolored, or painful. You should adjust or reapply the bandage every 3 to 4 hours. And lastly, elevate the injured area. This helps drain fluid away from the injury, which can bring down swelling. Sprains and strains are painful, so you may want to use an over-the-counter pain medicine. Ibuprofen works well to take away pain and to decrease swelling. Ibuprofen can be used every 6 to 8 hours. Naproxen is another anti-inflammatory medicine that works well. These medicines are very safe, but check with your doctor to make sure they're okay for you, especially if you plan to take them for more than a couple of days. It helps to use heat packs when the muscles or ligaments feel tight and stiff, often first thing in the morning. Heat packs or warm water baths help to relax and soften the muscles. When the swelling has gone away, it's time to start gently stretching the area to increase flexibility. When your flexibility is improved, the next step is to start rebuilding the muscles to help strengthen the injured area. Talk with your doctor about recommended exercises and when to go back to playing sports. Remember, it's important to rebuild the area, but pushing too hard too fast will make it worse. I hope your injury gets better, but call your doctor if the injured area is becoming increasingly painful, especially if not responding to over-the-counter pain-reducing medicines or if it's just not getting better like you'd expect. Thanks for watching this video prescription.